Every prescription you fill feels like a punch to the gut. Pills that bankrupt families, generics priced like gold bars. In 2024, Americans paid 2.78 times more for drugs than people in 33 other countries, including for generics made in India or medications discovered a century ago. Why? Big Pharma is exploiting the US market, charging Americans more for profit. From insulin to aspirin, this isn't just about numbers on a bottle. It's a financial fault line running through your life. This is TechFaultLine, where we expose the cracks quietly devastating your wallet and well-being. A 2024 RAND study pulled back the curtain. U.S. prescription drug prices are 2.78 times higher than in other OECD countries like Canada and Germany. Brand name medications, a jaw-dropping 4.22 times more, even after negotiated discounts. Consider insulin, discovered in 1921, $450 for a 10 milliliter bottle in the US, but only $10 in India. Or generic Metformin, created in the 1950s, $20 to $50 here, but just $2 abroad. With prices like these, many Americans are turning to desperate measures, smuggling drugs across the Canadian border or rationing pills. This is a crisis, warned health economist Michelle Mello. Regardless of a drug's origin or age, if you're in the US, you're overpaying. And this didn't happen overnight. It's the outcome of decades of policy decisions and profit-first frameworks. The U.S. healthcare system is a jigsaw puzzle of private insurers, Medicare, and Medicaid, with no unified bargaining power. In 2003, the Medicare Modernization Act specifically barred Medicare from negotiating drug prices. Add to that the 1984 Hatch-Waxman Act, which grants drug patents lasting 5 to 12 years, often extended through minor product tweaks like new insulin delivery pens. Big Pharma claims it costs $2 billion to develop a single drug, and those costs are mostly recouped through the inflated prices paid by Americans. Meanwhile, nations with centralized pricing systems, like Canada, the UK, and Germany, leverage their bargaining power to slash drug prices by up to 80%. The result? U.S. consumers carry the financial burden for global pharmaceutical development. Although the U.S. contributes 44% of global pharmaceutical R&D funding, a staggering $100 billion in 2023 alone. This underwrites innovations like Paxlovid, which treat patients around the world. But inefficiencies plague the system. Drug companies exploit America's regulatory freedom to charge whatever the market will bear, 4.22 times more for brand-name drugs compared to other countries. In the UK, the NHS pays 20 to 30% of what Americans are charged. Generic drugs produced in the same Indian factories cost $2 there, but $20 or more here. This is textbook price discrimination, and US consumers are left footing the tab. And the fallout is deeply personal. In 2024, a staggering 28% of Americans reported skipping doses or splitting pills to stretch out prescriptions, according to a Kaiser Family Foundation poll. Small businesses are being crushed too, like the Chicago bakery that dropped employee health coverage because they couldn't afford $500 in monthly drug costs. In total, Americans spent $405 billion on prescription medications in 2023, accounting for 10% of all healthcare expenditures. Why does this system endure? Because it's designed to. Patent evergreening lets pharmaceutical companies extend monopolies by making superficial changes to existing drugs. Pharmacy benefit managers, PBMs, like Express Scripts and CVS Caremark, apply 30 to 50% markups, even on generics made overseas. The fragmented U.S. system, lacking centralized negotiation power, can't compete with single-payer systems that drive hard bargains. Meanwhile, lobbying by PHRMA, $306 million in 2023 alone, helps stall any meaningful reform. The outcome? Even generic medications that cost $2 abroad are sold for $20 or more in the US. The system is rigged, and the American public is paying the price. Is there a way out? Change is crawling forward. The 2022 Inflation Reduction Act includes a provision that allows Medicare to negotiate prices on just 10 drugs beginning in 2026. That will save an estimated $3.7 billion by 2030, a mere 2% of Medicare's drug budget. Drug importation, legalized in 2020, has yet to deliver real savings. Florida's 2024 initiative saved only $39 million. Building domestic production capacity is another option, but it's not simple. The U.S. currently imports 40% of its generic drugs and 80% of their active ingredients from countries like India and China. Ongoing geopolitical tensions and rising tariffs, 54% on Chinese imports as of 2025, add more complexity and cost. Big Pharma defends high prices by pointing to the high cost of R&D and the critical innovations it enables. Pfizer alone invested $10.7 billion in research in 2023, leading to treatments like Paxlovid. But many experts argue that it's not R&D costs driving prices. It's the layers of middlemen, from PBMs to distributors, each taking a cut. As a result, Americans pay 2.78 times more for medications, even when they're made in India or invented in the 1920s. From $450 insulin to $20 metformin, it's a system built on price discrimination. And while Americans overpay, other countries get the same drugs for pennies on the dollar. This fault line threatens your health, your finances, and the pace of medical innovation. This is TechFaultLine. We reveal the fractures beneath the surface because you deserve to see where the system is breaking you.